Today. I'm Hani Kushlov. I'm the director of the fellowship program at University of Cincinnati. I'm not gonna make this a very long presentation. I will give you the high points of the fellowship and hopefully persuade you to apply for our fellowship program. So I have my email there and the coordinator's email and the web page if you want to know more information about the program. I thought I would start by saying congratulations for all the trainees who are choosing neuromuscular, a very exciting field. I think my colleagues who are with us, I'm sure they would agree. The field is exploding with progress. You will never be bored. You will actually have a difficult time keeping up with the progress in the field. So general information about the fellowship. Our goal is to produce at the end of the fellowship a well-rounded neuromuscular medicine subspecialist who would be able to practice either in an academic place or in private practice. The fellowship is ACGME accredited. It's a 1 year, and we take 1 fellow per year. The locations where the fellow trained include the Medical Center, the Neuroscience Institute, Cincinnati Children's Hospital, and the Veteran Affairs Hospital. It includes inpatient and outpatient training, and at the end of the fellowship, you'll be able to sit for the Neuromuscular Medicine Board exam from the ABPN and also the American Board of Electrodiagnostic Medicine Board exam. So the training, the clinical training includes outpatient and inpatient. Inpatient includes neuromuscular consults and EMGs. The outpatient training, the fellow will have a continuity clinic, but in addition to that, they will rotate through general neuromuscular clinics, the adult and children MDA multidisciplinary clinics, the ALS multidisciplinary clinic, and will do a lot of EMGs, including single fiber EMG, and get trained in ultrasound. Our fellows typically do more than 800 EMGs per year. That's a large number of EMGs. You will get exposure to autonomic testing, and you will do skin biopsies. Of course, the content of the fellowship can always be geared to the interest of the fellow. In terms of weekly didactics, we have neuromuscular lectures, we have neuropathology slide review and neuropathology conferences. And the neuropathology conferences, typically these are designed so whoever of the neuromuscular faculty had a muscle or a nerve biopsy done in one of their patients, we will meet together with the pathologists that include myself, and we will go over their clinical presentation and take it from the clinical scenario down to the muscle or nerve biopsy, and hopefully come up with a diagnosis and treatment plan. There is also a Neuromuscular Journal Club, case conference, and the neurology grand rounds. The faculty that you would be trained with include myself, who I have pathology training, so I also look at nerve and muscle pathology. I do neuromuscular ultrasound, I do single fiber EMG, I do everything, but the rest, I direct the MDA clinic, I direct the neuromuscular research. My colleagues, we have Dr. Quillen, who is the division director. We have Dr. Neal, who's the director of the ALS clinic. Dr. Sams, she is the VA neurology chief, and when you rotate with the VA, you'll be working primarily with Dr. Sams. We have Suishia Tien, and she is the director of the Neuromuscular Center at the Cincinnati Children's Hospital Medical Center, and Jonathan Smith and Joe Wang, they're newer to our division, and both of them do neuromuscular ultrasound and are interested in just general neuromuscular medicine. The places you will rotate through include the VA, Cincinnati Medical Center, Cincinnati Children's Hospital, Neuroscience Institute. The good thing about this is that all of these places are actually within walking distance. So it takes only 3 minutes to go from the hospital to the Neuroscience Institute. It takes about 7 minutes to walk from Cincinnati children to the hospital and to the VA is about 10 minutes walking distance. Some of the perks for the fellow: you get the parking space, you get 2 offices, one in the VA and one in the neurology department across the hospital in the Stetson Square building. You have library access. You will get to take the ANEM in-service self-assessment exams, so you prepare for the neuromuscular and ABEM boards, and then you get expenses paid to attend one neuromuscular national meeting, regardless of whether you present or not. In terms of Cincinnati, Cincinnati is a nice city. The Queen City has 4 seasons, so if you are a fan of 4 seasons, this would be a good place for you. It has all kinds of things that you can do for fun. There is always something to do for everyone in